Hi everyone, especially to Mr. Justin Philip Raso. Good evening, sir. I am Annalyn Alexao from Section B. Today I am going to memorize the causes of death. So, causes of death. First, natural death. It is a death due to disease or ailment of the body. The disease may occur or spontaneously or may have been consequences of the physical injury of physical injury of the physical injury of uh, physical injury inflicted prior to its development. The termination of life occur quickly and unexpected or delayed due to lingering illness. And then the next one is violent death. Violent death, it is a death due to injuries for some uh, for some for some outside force wherein the physical injury uh, inflicted proximate inflicted in the proximate cause of death. And then the classification of physical injury, first is physical injury, the second is thermal injury, um, third is electric injury, fourth change um, change change atmospheric pressure. Fifth is chemical injury. Sixth is radioactive injury. And then in the under violent death, first is the accidental death. Accidental death is misadventure uh, misadventure misadventure outside owns will. And then the next second one is negligent death. So negligent death, it is also a death due to reckless imprudence, negligence, lack of skill and foresight. And then the third one is infanticide uh, or neonatal death. So it is a death due to killing an infant and less than 3 days old. And then the fourth is parricide. So parricide, it is death due to killing a relative, mother, father, child, either it is legitimate or illegitimate, will be shall be guilty as parricide and shall be punished by re, uh, penal ranging uh, per, uh, from reclusion perpetua or death. And then the fifth one is homicidal death. So it is a death due to killing a person with intent but without justification. Next is the murder. So it is the unlawful killing of a person committed with the other following. So first is treachery. Second, in consideration of money, price, or promises. Third is um, w- uh, with with evident uh, premeditation. So the next is the euthanasia or mercy killing. Mercy killing is it is a willful acceleration death of a person in order to lessen the financial reasons and the sufferings. So the last one is suicidal death. Suicidal death is it is due um, to killing or distractions of kill our own life. So the next one that I'm going to memorize is the kinds of wants. So first, want. It is a break or solution of the skin or tissue of the living body. And then next is vital reaction. Vital reaction, it is the sum total of all reaction of the tissue or the organs of the physical injury or trauma. And then the third one is wound damage. So um, damage to the tissues, um, damage to the tissues caused by mechanical force. And the um, this includes the beating, um, kicking, punching, biting, and strangling, and physical and mechanics. But it exclude the injury from heat, cold, um, poison, and electricity. The next is the examination of the wounds. First, abrasions. The most superficial injury is called um, scratch and graze, and the most common cause of injury is when falling to the ground, falling to the ground with sliding motion. And then second is um, bruise or contusion. So bruise or contusion, it is caused by blunt objects, which is caused to blood vessels and leg vessels, um, blood leaks rather, and blood leaks to the surrounding tissues. Um, a rose is a vital injury. And then second is laceration. So laceration, it is a splitting, tearing wound caused by blunt instrument. So this won't bleed profusely because it involves the whole thickness of the skin. And then the third one is the incised one. So it is a cut injury from a sharp razor, knife, broken glass, and metal. And then um, um, a splash wound. So the length is greater than the depth. And then the last one of the examination of the wounds is the stab wound. So stab wound, stab wound causing sharp, sharp and sharp pointed and sharp instruments. So um, the depth is greater than length, and stab wound is generally the um, generally the fatal and most dangerous than the slash wound. In the than the slash wound, as they penetrate um deeply in the chest and in the abdomen rather. And then the next one that I'm going to memorize is the classification of burn. Dupuytren's classification. First degree. Slight swill, simple redness and slight swelling may subside after a few hours. Produce momentary application of flame, uh, of hot solid or liquid below boiling point. Second degree, vesicle information with acute information caused by a flame. And then a skin is blackened and surging of a hair, scar not present after healing. Third degree. Third degree is mm, destruction of cuticle, part of true skin. Burnt area is painful and leaving exposure to nerves endings. Um, healing 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 may leave scar. And then the next one, fourth degree, is um, a whole skin is destroyed with formation of slough, surface is recreated, and mm, healing produce healing produce deformi healing produce fibrous scars, and then uh, make contact and produce deformity. And then the fifth one is the involvement of deep fascia and muscle. Um, it may produce severe scarring and deformity. And then sixth degree, it charring of limbs, of organs, and or organ charring of limbs, of organs or bones. Um, that death was due to shock. 72% human body weight is water.